And then we talked about inversion and eversion. I'll put it on this other slide over here. Okay, so this is inversion and eversion, just looking at the calcaneus, right? And what joint does that motion occur in? The what? Subtalar, yeah. Okay, so that's between the talus and the calcaneus. All right, but now if you look at right here, that's going to be a different angle than that. So, I mean, you can measure, if you're talking about just in the rear foot, inversion, eversion, you can measure it like this, right? But here, if you're so that's only the subtalar joint motion. This, when you do inversion, eversion, you're talking about the forefoot as well. Because there's going to be a lot of movement that occurs in the tarsals and the metatarsals. Okay? So in that situation, you're going to be sighting down here and you're using this, and say you could use this as your reference, and then you'd be measuring it like that. Okay? So that's going to be, is that going to be a larger number or a smaller number than this? Yeah, because you're moving more of the, you're doing more of the foot. So when you're doing your final, again, it's going to be the same thing as the midterm, and it's also going to be the same as when you did your case study. So what's the first thing that you do? Right. So you're going to go through all the, you said all this stuff before, and so what's typically the first thing you want to know as far as when you're doing a history?
How did it happen?
Right. So mechanism of injury. And then you want to know, is that an acute injury, or is it repetitive, or is it re-aggravation of an acute condition? Okay. So then, I mean, all this stuff's in the notes. We've talked about it before, and then also if you listen on the secure site, there's audio files that talk about how to do this. One of the things that people sometimes will forget, and I'm trying to see if it was in here. So actually in the notes on page 7, if you go at the end of old cards, and I guess that these other two things haven't really been worked into the old card mnemonic, is that you want to know, have they had any treatment for it? Either for this current episode or previous episodes. And then also you want to know if they've had the same injury before, or if they have anything significant in their past medical history. So just make sure you don't forget those. Because if you go, I think if you go through the old cards, you may not necessarily remember to ask, has it ever happened before? Have you had any treatment for this, either this on this occasion or on previous occasions? And then I usually will also ask, have you had any significant injuries? I mean, if you're talking about musculoskeletal history, you want to ask, have you had any previous injuries, broken bones, slips and falls? And a lot of times when you're questioning somebody, they'll say, oh no, nothing happened. Like, oh, well, yeah, there was that time I fell out of the 2-story building when I was 2 years old. I mean, at that age, usually kids, when they fall, they bounce, right? You can recover a lot, but you still want to know. Sometimes it takes a little digging, and you ask, are you sure? Did you happen anything when you were growing up, or any significant injuries, things like that? Because sometimes they don't necessarily bring it up, but you want to make sure to question it. Because if you're going through the history and something doesn't make sense, it's like, well, why does this person have all? You look at an X-ray and they've got this DJD substantially at one particular joint, or it's like, well, yeah, something must have happened. I'm like, yeah, well, I got dropped on my head, or I fell off a horse, or something like that. But no, that was when I was 10 years old. So sometimes you need to dig out of them previous history things. Okay, so then what do you do after, let's say you do all the history, what comes next? Right. So what are the things that you're going to look for that?
Deformities.
Okay. Deformity, what else?
Gait, swelling, color, discoloration. Well, I guess I'm going to do maybe palpation.
Yeah, unless you've got some kind of visual abilities, you can't really see heat. Right? Unless you got the $3 million man, I mean the $6 million man eyes, right? Now, as far as we're talking about deformity, and then mentioning intelligence and like that. Basically, you want to look for any type of pain avoidance behavior, because like sometimes all they talk about is intelligent posture, where somebody's leaning over like that. But also, you want to look at something like, you know, when they turn their head, they go like this. You know, is that gait? No, not really. That's, you know, guarded movements, things like that. Any abnormal movements. And then also posture, right? So, you know, if you're looking at, well, I guess we're not talking about circles. So, we're talking about, you know, somebody has increased lordosis. If you're looking from the posture, you're looking one shoulder's higher or lower than the other, pelvis is on level, something like that. You're looking, again, if you look at the feet, you're looking at is there pronation, supination, and then if you check their gait, you can see if there's pronation in their gait. So we mentioned check if there's any swelling, any deformity, any discoloration, any posture, any antalgic movements or guarded movements, things like that. Okay, then what's next after that? Yeah, and like I mentioned before, there's different schools of thought as far as the exact order. In some situations, as far as like I mentioned before, if you're going to be doing like deep palpation of a specific joint, you don't want to do that before you do range of motion, because if you go flare up some kind of trigger point or irritated muscle or tendon or ligament. So in some cases you want to do the range of motion first. Now, as far as the way you do your exam, you're not going to get graded down for changing the order around, but if you miss something, then that's where you have problems. Okay. So palpation, then what are you going to be doing for palpation? So like in this situation here, we have palpation of the ankle, but you're going to treat any area basically about the same. So what types of things are you going to palpate for?
Increased tenderness.
Okay.
Or looseness.
Yeah, usually in palpation, yeah, if you're doing, that's more, yeah, that kind of would be more range of motion and special tests. Okay, so tenderness. Now, to get into more specifically, what are you going to do when you're palpating? As far as tenderness, you want to find out what? Where is it? Right? Because when you're getting palpation, you want to go in there and find specifically where it is, because that's going to, with your thinking of your anatomy, then you're going to know, okay, that's right where there's a ligament, or that's right where there's a tendon, or that's where this muscle is, or something like that. Okay? So you want to know the exact site of the pain. And then, you know, again, some of that's going to be in the history too. When you ask them, can you point to me with one finger where the pain is? Because in the history, you want to know, is the pain, is it diffuse over a whole area? Like, is it in the low back all the way going down the leg? Or is it like right here, right here? Okay? Because a lot of times, as I mentioned before, when people say, yeah, I get pain in my hip, and you say, point to the pain, they say, it's right here. What is that more likely going to be? Yeah. Because a lot of times they'll say hip, and they'll be thinking about the SI. I mean, if somebody really has a hip pain, it's going to be more like right here. Right? And then if they can't put one finger exactly on it, if there's more of a diffuse type of pain, that's also something you want to know.